mygotodoc.com. I'm a functional medicine physician. I've been practicing medicine for almost 20 years, and my specialty has been functional medicine. So, this is sort of a repeat of what we did a couple of weeks ago, but there were so many questions coming in that I wanted to give a summary of what we talked about a couple weeks ago. It's just an introduction to functional medicine and give you all out there watching an opportunity to ask questions. So today is just going to be a brief summary about what functional medicine is, how it can be helpful for you. But really, I want to dedicate this week's session into answering as many questions you might have about functional medicine. Again, my name is Dr. Ryan Shelton. I am with mygotodoc.com. And the topic today is just an introduction into functional medicine. So, functional medicine encompasses a dynamic approach to the assessment, the prevention, and the treatment of complex chronic disease. It's not well suited to acute disease, a middle ear infection, an ankle sprain, but it matches wonderfully with chronic disease. Now, why is it so important? Because 50% of adults in the United States suffer from at least one chronic disease, and about 33% suffer from multiple chronic diseases. And chronic diseases account for about 85% of all healthcare costs. That's why it's important. Now, what are the benefits of functional medicine? So, you may want a doctor who treats you as an individual and not just focuses on you treating your illness. You may want your treatment to be personalized just for you, not a generic band-aid that's strapped on a symptom, but a really personalized treatment that encompasses your genetics, your environmental impact, your behavioral and lifestyle implications, nutrition. So you want an individualized, personalized treatment. Maybe you're interested in functional medicine because you want to discover the root cause of the illness and not just treat the symptoms with the prescription medication. Perhaps you're seeking functional medicine because you want to be an integral part of your treatment. You want to actively participate in managing and improving your own health. Maybe you're interested in functional medicine because you have chronic pain or a chronic health disease, and you don't want to rely solely on pharmaceutical medications. You think that there are other options out there. And lastly, a benefit of functional medicine is that you can look deeper into your chronic health disease through using functional laboratory testing that most conventional doctors are not as familiar with. Food allergy testing, hormone testing, GI testing. So there are several examples of sophisticated functional medicine tests, laboratory testing that can be performed that most conventional doctors are not familiar with. And treatment usually involves nutrition, diet, therapeutic movement, balancing of hormones, improving the gut health, detoxification, the mind-body connection, and of course, when needed, supplementation or prescription medication. So again, that's just a very brief introduction into the benefits of functional medicine. Today, I want to spend most of my time in answering any questions that viewers out there may have. So a first question has come in. I was thinking about ivermectin for shortness of breath and exercise intolerance. Is that what you would suggest first from the protocol? So I'm not really going to give individual medical advice here on this live stream today. I would need to know more about your complex medical history, other medications that you might be on. So I'm not really able to give individualized advice today. Certainly, if you set up a consultation with myself or one of our other physicians, we'd be happy to give you individualized advice, but I'm really not able to give you specific advice today. Yes, in some cases it can be helpful. However, in some cases it might be contraindicated. Another question has come in. I had COVID in May and I was wondering if it can cause thyroid problems. Absolutely. So, one of the many negative manifestations of long COVID is that it disrupts the balance of hormones throughout the body. And one of the most sensitive glands that produce hormones in the body is the thyroid hormone, more times than not, because of the inflammation that long COVID patients experience, the protracted inflammation that long COVID patients experience. It results in hypo or low thyroid. However, I have seen cases of hyper or high thyroid as well. Let's see, the question continues. I also have ischemia of the right frontal lobe. Could that be caused by COVID? It certainly could be caused by COVID. It's really impossible to say without knowing if that ischemia was present before the COVID infection. Um, Without a before and after, it's difficult to say if COVID was the cause, but it certainly could be, or it could be a contributing factor to that ischemia. I've had a kidney transplant and did not get vaccinated. Okay. Next question. Short-term ivermectin and low-dose naltrexone for remaining neuro symptoms of COVID. 2 years since positive, have improved over the year, 2 years slowly, but want to get 100% clear. Currently taking supplements and probiotics. So yes, this question came in from Rhonda. Rhonda, it looks like you're on a or you have been on an excellent protocol. I would encourage you to set up an appointment with a functional medicine doctor, really utilizing those functional medicine laboratories to get a better understanding of inflammation, of hormone imbalance, of GI health, because COVID certainly negatively disrupts many symptoms, multi-systematic throughout the body. It disrupts physiology throughout the body, and that's where functional medicine can really play a positive role. Let's see, another question has come in. Can functional medicine deal with burning mouth syndrome? It certainly can. Again, it depends on what the root cause of that burning mouth syndrome might be. Likely due if it's post-COVID, likely due to the chronic hyperinflammatory state, the microclotting that's involved, and functional medicine is definitely indicated for burning mouth syndrome. Sometimes that can be due to environmental toxicity. Sometimes it can be due to inflammation, other viral infections that COVID may have kicked up, unfortunately. But yes, functional medicine can absolutely look into burning mouth syndrome. Let's see, another question has come in here. Are there any negative side effects from ivermectin that you should know about? So that's really individualized. Sometimes it can cause some neurological symptoms. Sometimes it can cause some cardiac symptoms. It can certainly cause headaches. That's in my experience, individuals who experience side effects, it's really individualized. That's why when you see those drug commercials on TV, you have to wait through that long list of side effects include, because while one person may experience one side effect pretty strongly, another person may not and experience a complete different array of side effects. So yes, ivermectin can cause side effects. No medication, no herbal supplement is without side effects, but the specific side effects that it might cause is really variable from one individual to the next. Let's see here. Next question has come in. Can you treat IBS with the functional medicine approach? IBS is wonderfully suited by a functional medicine approach, and that all starts with gut health. So assimilation, looking at permeability, looking at intestinal microbiome. IBS, you're usually looking at inflammation in the intestine, poor assimilation, poor permeability, poor microbiome. There are certainly a number of functional laboratory tests that can be utilized, but typically looking at the diet, looking at ways that we can improve the digestion, the assimilation, the permeability, the microbiome. Functional medicine is wonderfully suited for IBS. Let's see, let me scroll down a little bit. I love the questions, viewers, keep them coming in. Is it best to see a functional medicine provider in person? Certainly in the age of COVID and post-COVID, many medical practitioners and many functional medicine doctors have went to virtual visits, video consultation, because oftentimes a physical hands-on examination is not required for each and every patient. Sometimes it is, but oftentimes it is not a hands-on physical examination. After all, that's really the only reason that you need to see someone in person, other than just familiarity with the provider. Laboratory tests can typically be ordered, and you can go to a lab draw station that is local to you. Laboratory kits can be sent directly to your house, or and then sent directly to the lab. So there are a lot of really innovative ways that telemedicine has expanded and grown since 2020. And cutting edge functional medicine doctors typically do not require in-person visits to achieve all of the goals that they may need to achieve with their patient. Let's go to the next question here. Have you seen someone's back break out with almost like shingles all over the back after COVID? Any recommendations on how to help? Yes. So a curious thing about COVID is that it can reinstitute viruses that may have been hidden in the body. And in the case of shingles, it's probably along the spinal cord. The virus was just hiding out, evading your immune system. But we do know that COVID can pull these hidden viruses out and cause reinfection, even if the infection was decades ago. So you may have had chickenpox when you were a kid, and it's been hiding out in your spinal cord for 20 or 30 years. And COVID may open the door for that virus to come out and do its nasty business all over again. So yes, that can certainly occur. We've seen it. And the best approach is functional medicine, trying to boost the immune system, trying to quiet down the inflammatory system, trying to improve gut health. There are a number of things that functional medicine can do for that. Any functional medicine? Is there any functional medicine protocol that can help with dry or wet macular degeneration and or cataracts? Well, that's a great question. And so this is both macular degeneration and cataracts. They're examples, albeit localized to the eyes. They're examples of chronic disease. And with any chronic disease, it really depends on where on the timeline you're able to catch it. If it's early stages, functional medicine can be remarkably effective at least stalling the progression, if not improving what has already occurred. If the cases are more advanced with the macular degeneration or cataracts, functional medicine will have more challenges to reverse anything that's already happened. It can certainly be, even in advanced cases, it can certainly be effective in preventing the progression of further deterioration. So it really depends on where in the timeline you catch those chronic ocular diseases. Let's see here. I had COVID Thanksgiving. Okay. I still have taste and smell issues. Yes. Today I saw that nicotine gum can help. Yes, and it's curious on how nicotine gum can help. If you don't smoke, don't start, and if you don't chew nicotine gum, don't start because nicotine is very addictive. But nicotine works on nicotinic neurological nerves receptor synaptic sites, and it can improve some of those taste and smell issues. In terms of risk and reward, nicotine may not be the best choice because, again, it is addictive, but biochemically, it makes sense why nicotine would help with the taste and smell issues. I also saw the stellate ganglion block. Yes, that's a more invasive procedure, certainly. And bottom line, the gum may work. Theoretically, it may work, but you run into that nasty issue of addiction, and nicotine addiction is one of the strongest addictions out there. So I would caution you with that. Have you heard of lumbrokinase, and is it effective? That's kind of an open-ended question. It can be effective, primarily as an anti-inflammatory enzyme agent. Um, I wouldn't necessarily use it as my first staff protocol, but it can be effective at decreasing inflammation and improving some symptoms. Let's see. Oh, that one just got erased. Next one I see. Can functional medicine help teenagers with anxiety, ADHD, extreme mood swings? Absolutely. So I'm still on the admissions board of a therapeutic behavioral health program on the Big Island of Hawaii, and have been since 2014. They primarily treat adolescents and young adults, so ages ranging from 13 to about 26 or so. And that's what that program primarily gets: depression, anxiety, ADHD, bipolar, extreme mood swings. And the program uses primarily functional medicine and integrative psychiatry, and they have remarkable success, not just short term, but long term. They've done studies, and 7, 8, 10 years out, the kids, now adults, are still doing quite well. So functional medicine is an excellent fit for teenagers with anxiety, ADHD, and mood swings. Let's see here. Have you worked with eosinophilic esophagitis? Yes, I have. Okay. I tried to go the route of allergy testing, which was a dead end. So, eosinophilic esophagitis, it's a chronic disease. It can have acute flares, which can be very uncomfortable. And it's an issue of inflammation, but eosinic means that it's a particular type of immune cell that is attacking the esophagus. Allergy testing for eosinic esophagitis, that would not be my first approach. I'm assuming these are maybe like food allergy testing or back scratch testing where you're doing environmental allergy testing. I have not seen that as a primary approach to be effective. But it certainly can be if functional medicine can be effective with eosinic esophagitis if we're able to get that immune system in better balance, get the inflammation under control. But again, allergy testing, I wouldn't expect it to be a primary approach. Let's see here. Are there any negative side effects from taking quercetin? Good question. So quercetin, it's an antioxidant. It's in high amounts in yellow onion, for instance, and garlic. It is helpful for its anti-inflammatory effects, its anti-allergic effects. It can be coupled with vitamin C pretty well to help with seasonal allergies and hay fever. Quercetin absolutely can interfere with some chemotherapeutic agents, so I would caution you with that, even with some medications like ivermectin. So I would caution you with that. So quercetin, we're really looking at interactions with other supplements, with other pharmaceutical agents. By itself, it tends to be very well tolerated. Even pediatric patients can take quercetin without much trouble. If you take too much of the quercetin, it can cause some GI distress. But other than that, it's pretty well tolerated. I didn't read the rest of your question. For me, it really helps cutting down the production of excess mucus. Sure. It dries up other liquids like tears and saliva. Yes, it can do that. So it is a mucolytic agent. There are others. One of the most powerful natural mucolytics is NAC, or N-acetylcysteine, which I think may have recently been taken off the market. It used to be available over the counter for years, but I think it was recently taken out of the market. Physicians can still get it. NAC, that is. It's a powerful mucolytic. Quercetin can be a mucolytic as well, but yes, it can dry up other tissues like tears and saliva. Let's see here. Next question. Ringing in the ears. Yes, the tinnitus. Can functional medicine have a solution? It can, and so that depends on the duration that you've had tinnitus and the severity of tinnitus and the root cause of tinnitus. Certainly if tinnitus is also associated with hearing loss, then you may have to look into other root causes. But yes, functional medicine, if we can balance out that immune system, balance out the inflammation, improve microclotting, we can make some inroads in treating tinnitus. Also, depending on the age of the patient, I've seen women going through menopause and men going through andropause. A change in hormones later on in life, in your 50s and 60s, can definitely contribute to tinnitus. And I've seen bioidentical hormone replacement be effective treatment for tinnitus. Can functional medicine help alleviate food allergies? Yes. So functional medicine is the gold standard. It is the preferred type of medicine for treating food allergies. Now, food allergies is a little more complex than just diagnosing the food allergy itself. That's the easy part, diagnosing what food you might be allergic to. The easy solution is identifying the food that you might be allergic to and then simply avoiding that food or limiting it to the best of your ability. But most people don't do the harder part, which is fixing the damage that the food allergy caused in the first place. So they usually have depleted digestive enzymes, inflammation in the GI tract, dysbiosis, so a change in the microbiome of their large intestine. So yes, functional medicine is absolutely wonderful for treating food allergies. However, I would encourage you to do the hard work, investigate on what kind of damage that consuming that food over years has done to the GI tract. Eliminate the foods, but then fix the GI tract so that your body is better able to assimilate nutrients. Another question came in. Have you heard of mast cell activation syndrome? Yes, and there are different types of severities of MCAS. It's abbreviated. Um, in the most severe cases, it can cause an anaphylactic reaction, which is life threatening. Your airways start to close off and you can't breathe. And then there are much more mild cases, and I say mild. Anytime a patient suffers from MCAS, it can be debilitating, but it can go anywhere from extreme anaphylactic reactions to GI distress if the mast cells are really affecting the GI system. And then the classic case would be skin disorders like urticaria or hives. Um, and functional medicine is a wonderful treatment option for MCAS. We can improve inflammation, we can improve GI health, we can calm down that immune system. So yeah, great question. Let's see. Cool. I think I've caught up on the questions. So until I see a couple more, oh no, no, I just have to scroll down. I'm sorry. uh, let's see. I got lost on my page here. I apologize, y'all. Okay, next question. Is there anything that functional medicine is able to do for patients suffering with neuropathy in the hands and feet? Definitely. So, uh, more times than not, that's due to inflammation of the nervous system, sometimes microclotting. Occasionally, you see nutrient deficiencies that might contribute to neuropathy in the hands and feet. A couple of B vitamins, alpha lipoic acid, but more times than not, neuropathy in the hands and feet. And it can be due to toxicity of pharmaceutical medications. Excessive alcohol consumption can cause neuropathy in the hands and feet, but more times than not, it's due to inflammation of the tiny little nerves in the hands and feet. Again, functional medicine is a wonderful approach. It's a comprehensive approach. It can deal with that inflammation. It can quiet down the immune system, and there are some botanical agents that can, depending on how long the neuropathy has been going on, that can restore the health of the actual nerves themselves. So not only are you dealing with the root cause, you're treating the effects of the root cause. All right. So next question is specific to a long haul COVID patient. Any functional medicine protocol that can help with long haul chest tightness? I've tried breathing techniques, inhalers. Have you tried a nebulizer? Sometimes nebulizers are more effective than inhalers, muscle relaxants, other medications, but it's a stubborn symptom that has been around for, gosh, almost a couple years now. Yes. So again, this is going back to the same old thing that nasty COVID virus does. It causes hyperinflammation throughout the body, microclotting throughout the body, and functional medicine is a wonderful form of medicine to help correct those. And again, if you haven't tried nebulizers, sometimes nebulizers can be helpful for that chest tightness. It tends to be due to a cause in the inflammation of the pleura. So this tiny little film that surrounds the lung tissue, it becomes inflamed. Um, Sometimes it's the lung itself, but more times than not, it's the pleura. So addressing the inflammation and the microclotting that the COVID virus can cause. What is the role of functional medicine for pediatric neonatal services? So once upon a time, 19 years ago, my practice was pretty heavy in pediatrics and newborns. Um, I shared an office with 6 midwives, and I got every single one of their babies that they delivered. So most of the time for newborns, you're just doing physical examinations and ensuring that they're developing and that they're growing, they're getting the proper nutrition. Um, Sometimes with newborns, you're looking at uh, colic or stomach pain, earaches, and yes, functional medicine has a role to play in those cases. If it's a more serious condition in a newborn, that's always referred out to a specialist. And the same goes for pediatric patients. Here, you're just looking for development, for growth, making sure that they're getting proper nutrition, limiting their screen time, uh, and as long as the basics of health are covered, then for the most part, pediatric patients, um, they have acute health issues that come up: GI distress, skin issues, breathing issues like asthma, um, eye problems, ear problems. So you're looking at mostly acute, but and in both the newborn patient and pediatric patient, environmental toxins can definitely affect health in that population, be they the forever chemicals like phthalates and oh my goodness, what happened? There we go. Be they the forever chemicals like phthalates and BPAs or heavy metals. And I've personally worked with a number of cases where there was a clear environmental toxicity going on. You eliminate the toxic source, and you clinically detox the kid, and suddenly, excuse me, suddenly um their asthma gets better, or their eczema gets better, or their behavior gets better, or their speech patterns improve. So there is absolutely a role of functional medicine in that population. Let's see here. Moving on. What would you recommend to improve high blood pressure without taking drugs? Well, there are a number of diet and lifestyle changes that can be implemented. There are a number of herbs that can be taken to be effective for high blood pressure. Um, in terms of, excuse me, in terms of lifestyle, the key is staying active. In terms of diet, the key is mostly around the sodium to potassium ratio. Americans eat way too much sodium or salt, and far too little potassium. And so, really switching that balance so that it's more like a 2-to-1 ratio instead of a 10-to-1 ratio. And salt is in basically all fast food, restaurant food, cooked food, processed food. Um, so really watching the sodium content, lots of fresh fruits and veggies, nuts and seeds, beans, legumes, eliminating eliminating processed foods as much as you can, refined sugars as much as you can. And then, like I said, there are a number of amino acids, L-arginine, for instance, and botanical agents that can be helpful as well. Um, Hawthorn can be helpful. Black seed can be helpful. Um, Chrysanthemum can be helpful. There are a number of herbs that can be helpful for treating high blood pressure. And again, that all depends on the severity. Uh, through even our best efforts, if we're improving lifestyle, if we're improving diet, if we're taking the indicated herbs, we might be able to drop blood pressure, and we're losing weight. Being overweight is a contributing factor. We might improve blood pressure by maybe between 5 and 25 points. So we're not going to put you from a 220 into normotensive, and it certainly also doesn't happen quickly. So sometimes these functional medicine approaches take a little time. Okay, let's see here. Where are we? How to improve insomnia after COVID. Yeah, that's a symptom that I think more people suffer from than is spoken about. That's that's a symptom that I call a by the way symptom. So they come in with a primary complaint or two, and then at the very end of the appointment, oh yeah, by the way, I'm just not sleeping very well after COVID, and that's a common symptom. And I think it's underreported. I think more people need to recognize that sleeping difficulties or insomnia that wasn't there before can now be present after COVID. So um, functional medicine is a wonderful approach to insomnia. Again, mostly that's two things. That's decreasing inflammation and balancing hormones, because COVID can wreak havoc um, on sex hormones, on thyroid hormones, on adrenal hormones, causing differences in circadian rhythms of all of those hormones. And so, correcting those root causes of the insomnia is really where I would focus. Yes, there are some herbs that can help calm the brain, but none of them are narcotic. None of them are like Ambien that are just going to knock you out. So it's a multi disciplinary approach where we're looking at utilizing functional medicine to improve some of the effects of COVID. And then we can add in proper sleep hygiene and making sure that you're taking the appropriate calming herbs before bedtime to give you the best chance that you can have for a great night's sleep. Can functional medicine help with genetic high cholesterol? Now, that depends on what kind of genetic hypercholesterolemia we're talking about. There are some forms where, if you have both alleles of a certain enzyme within the body, it's very difficult to overcome that without some medication. If it's just one allele, genetic allele that you have for the high cholesterol, that can be overcome through functional medicine. So that really depends on the type of genetic hypercholesterolemia that we're talking about. Mhm. Let's see. My 14-year-old got COVID January 22, suffered from headaches, stomach aches, dizziness every day since. Common. As you can imagine, this is hard on our entire family, of course. A 14-year-old is hard on your entire family. I'm kidding. Suffered from headaches, stomach aches, and dizziness. That's not good for a 14-year-old to be going through. We've tried medical doctors, naturopathic, chiropractic, acupuncture, Botox, physical medicine, laser therapy, and a host of other things. I'm wondering if you have any experience with a similar case, and what would you recommend? Um, I ultimately I would, because I'm a proponent of functional medicine, I would recommend functional medicine. I really have to look into the history of the other treatments that have been tried and not been successful. I have to look into the history of maybe other laboratory tests that have been run and what the results of those were. Um, and functional medicine is really in part it's storytelling. It's me as the functional medicine doctor being an anthropologist and really understanding the story of the patient or the culture of the patient. And that means understanding the patient's history, the patient's influences. And that's good data. What you have is good data. You've tried certain treatments and they have not been successful. So what I would advise is to have someone look over what has been attempted in the past. Perhaps there have been some rocks left unturned where we might have some some headway so that we can understand your son's story a little more clearly. Let's see. Next question. Ever since I have had COVID, um, for about a year, I have been dealing with severe anxiety to the point where I can barely function. I've been in and out of hospital with panic attacks. What can I do to get my life back? Yes. So, COVID, similar to insomnia, COVID can cause um, mental and behavioral health issues. It can cause depression that wasn't there prior to the infection. It can cause anxiety that wasn't there prior to the infection. Um, it can cause bipolar that wasn't there prior to the infection. So we know that it's probably more common than is what's being reported. And if the anxiety or depression was pre-existing, even at a mild level, COVID can just exacerbate what was there before the depression or anxiety. And yes, panic attacks can be very, very debilitating to the point where you have no choice but to go to the hospital to try to just get a grasp on what's going on inside. So again, I would have to know more about your history, what medications you're on, what your story is, what your lifestyle is. But functional medicine, definitely in the adolescent population, and definitely in the adult population, um, functional medicine can be effective for addressing some of the root causes of anxiety. If you're looking at something that has occurred post COVID in its entirety, then here we're looking probably at two primary areas. We're looking at inflammation, microclotting, and then potentially an imbalance in hormones, thyroid hormone, adrenal hormone, sex hormones. Mhm. Yeah, I've had a couple questions. I missed one above. It was a question about it was a question about the negative side effects of post COVID or long haul with cardiac health. Here's another question: is there anything being used for the palpitations um, post COVID? Mine go up to 155, bounces all over, and it's happening more since COVID. Yeah, and COVID can cause cardiac issues. It can cause changes in blood pressure. It can cause heart palpitations. Absolutely, that's pretty common. And that is likely due to inflammation affecting both the cardiac muscular tissue, in addition to inflammation of the nerves that supply the heart and control the rate and the rhythm of the heart. And so we're back to this old story again of addressing that inflammation that COVID causes, the microclotting, and balancing the hormones. And my assistant just gave me an alert that there are many more questions. And yes, we've got about 10 minutes left because in about 10 minutes I need to go and pick up my sons from school, and they would be quite cold if Dad didn't show up and pick them up from school. So let me get to a few more here. We will be back next week, same time, same place. So please tune in again and start making appointments for functional medicine. We just opened this branch at mygotodoc.com recently, and so we're excited to offer this service. Again, next week's discussion will be more focused on functional medicine laboratory testing. So, but I'm happy to in 2 weeks from now to do just another general discussion and Q&A. I love the questions that are coming in. Let's see. I'll pick one here. What is functional medicine approach to Lyme disease? Great question. Um, and that requires a complex answer that we don't have time for today. Lyme disease is it's complicated. It's just as complicated as COVID, and unfortunately, COVID can um, cause Lyme disease, even that's been kind of latent or quiet for years, to rear up again and flare up again. Um, so we know that those two microorganisms interact frequently, and we know that one aggravates or exacerbates the other. The functional medicine approach to Lyme disease is it's similar to that five pillar approach that I laid out early in today's discussion. Really looking at diet, nutrition, hormone balancing, looking at the gut health, the mind body relationship, and then taking supplements or pharmaceutical agents specifically targeted at the microorganism, balancing out the immune system, decreasing the hyper-inflammatory state in the body, balancing out the hormones. So, functional medicine, don't get me wrong, functional medicine is not a simple approach. It is a very strong approach, but it involves you being proactive and interactive with your provider to make sure that the recommended changes actually take place so that we can begin to see improvements. And it also takes patience on the part of the patients, because functional medicine, it isn't a quick fix. It isn't a band-aid that makes symptoms go away right away. Most of my Lyme disease patients, they may not even start to really see the benefits of functional medicine, uh, the approach of functional medicine, for maybe 3 or 6 months. But when they do start to see it, they're all in. And, 12 months down the line, they're wide-eyed and say, wow, I can't believe a difference that made. So I try to do some things to really fast pace the improvements in the first month or two, so that the patients are with me, and that they're able to establish a relationship with me. But these chronic diseases, there's not a quick fix. I know some of my colleagues have said, for as many years as that chronic disease has been around, expect to wait that many months until you see improvement. So, if you've had a chronic disease for 12 years, that might take 9 to 12 months before you really start to see some dramatic improvement. Certainly, you can see improvement before that, but for you to really feel like you've got your life back and it's under control and it's in a state of better health and wellness, um, it can take a while sometimes with the functional medicine approach. Okay. Yeah, and this is another question about Lyme disease. Husband completely healthy before vaccines. Now he has ALS, but we know the root cause is Lyme disease. Yeah, so I'm assuming the vaccines were for the COVID vaccine, and it does not surprise me at all that the COVID vaccine caused a flare of the original Lyme disease, which now may have resulted in the ALS. That makes complete sense to me. Can functional medicine help with kidney stones? It certainly can. I've helped my own wife and my own older brother with chronic kidney stones through functional medicine, and other patients, but just personally, my brother and my wife. Let's see. I was prescribed Synthroid after the birth of my second child over 30 years ago. Was told by doctors that once you're on it forever. Does functional medicine address options? Well, hypothyroidism, postpartum hypothyroidism, is actually pretty common. And in about half of the cases, in my experience, because I've worked with a lot of pregnant women, um, typically about half of those cases improve, if not completely go away after time. Now, what does that time look like? 1 to 5 years, maybe. So I'm saying 50% either significantly improve or dramatically improve um, within a few years. However, some don't. And in the other 50%, it may mean that you need some kind of hormone replacement therapy like Synthroid, although Synthroid really isn't a hormone, it's synthetic. There are bioidentical options out there, by the way, for thyroid hormones. I would encourage you to pursue those. Um, and so the other 50%, yes, maybe it does mean that you're on something forever, but functional medicine can improve thyroid function, making it so that your thyroid is more stable. You're not needing to change the dose of the Synthroid that you're on, or B, that you can decrease the dose of the Synthroid that you're on, and potentially wean yourself off completely, but at least wean yourself down off the dose. So yes, functional medicine um, can quite effectively treat hypothyroidism, regardless of the cause, if it was due to the pregnancy or to COVID or to uh, Hashimoto's, which is an autoimmune version of hypothyroidism. Uh, let's see. This is probably the last question I'll get to today. I'm so sorry that I'm not able to get to all of your questions. I encourage you to tune in each and every week, where we're going to try to to have a slightly different topic on functional medicine. And if you still have a question that I haven't gotten to today, and if it's slightly off topic, you can try to slip it in, and I'll try to get to you next time. Okay. Um, let's see. Last question I'll get to here is maybe I'm having sleep problems, staying asleep, night sweats, etc. And it has been about a year after starting the vaccine. Yeah. So post-vaccine, post-COVID, can cause problems with sleep. We addressed that earlier with another question. If it's specifically associated with night sweats as well, my guess is that the vaccine, or in your case, the vaccine, my guess is the vaccine has caused some dysregulation and dysfunction, imbalance in your hormones, which can definitely occur. And so here we're looking at um, evaluating what your hormonal status is. And it looks like, what's your name? I assume you're a male. So that involves looking definitely at testosterone, testosterone, free testosterone, DHEA, but also some of your female hormones. Believe it or not, males out there, you do produce estrogen, you do produce progesterone. So evaluating those levels as well. That would be my guess, without more information, that the vaccine caused a dysregulation in the balance of the hormones. All right, so I very much appreciate all of your time today. I did my best to stay on task and get through quite a few questions. Again, next week, same time, same place. Tune in. make an appointment for a functional medicine doctor at mygotodoc.com. My name again is Dr. Ryan Shelton. I am pleased to see you every week, and I love the questions that are coming in. So I appreciate your time, and hopefully we'll see you next week. So have a blessed week and take care.